Good evening, everyone, and welcome. Today or tonight, we are going to be talking about vertigo and dizziness on a more medical side with Dr. Udani. So Dr. Udani realizes there could be lots of questions, and you can reach out to her, text her at 437-702-2112. So Dr. Udani is a licensed naturopathic doctor here at Justine Blainey Wellness Center, and she's really passionate in a lot of areas, including women's health and digestion, pain, stress, and skin conditions. And she genuinely believes that everyone has the ability to make healthy, long-lasting changes. Please help me welcome Dr. Udani.
Thank you, Angela. Hi, everybody. So today we're going to talk about dizziness and vertigo and how to differentiate between the two and some potential ways that we can help improve that. So here are some of the upcoming webinars that we have. So we're going to be talking about core strength to protect your back and waistline. It's going to be so fun and important, especially now that we're still, we're kind of working from home. So Dr. Justine will be walking us through this. We're also going to be seeing how does vitamin B12 help keep your brain healthy. So Dr. Justine is going to talk about this as well. Then we're going to be talking about one of our number one killers, heart disease, and how we are unintentionally feeding this disease. So both myself and Dr. Justine are going to be talking about this. And then we'll also have movement, freedom through fitness talk, and flexibility and movement journey interview with Jessica. So these are all super exciting and interactive, and we hope you're going to get a lot of knowledge out of these. So today we're going to be talking about vertigo and dizziness. So some of these can be very debilitating for a lot of people, and it's something that we want to talk about to figure out what are the two different types of vertigo, what are some things that can cause vertigo, as well as how to differentiate between vertigo and dizziness, and some things that we can do for our lifestyle and for our diet that can help with managing some of these symptoms. So what is vertigo? So this is something that, it's very, if you experience this, you know exactly what it is. Because if you've been on, let's say, for example, an amusement park ride, you know what it feels like. It feels like the world is spinning around you, and it just feels like you can't stop, or you need to grab onto something to kind of help yourself. So the two most common forms of vertigo are central and peripheral, and we're going to go more into detail about this. So vertigo versus dizziness. So the dizziness is, so people who experience vertigo, they actually say that they genuinely feel like they're moving and that the world is spinning around them. So there is a huge sense of movement, even though there's no movement. So this is where, you feel like you're standing, but then it feels like the world is just like topsy-turvy. You feel all out of balance, and it just feels like you're experiencing this. So this can be really hard on your daily lifestyle. If imagine you're driving and you start to feel vertigo, or you're walking, you start to feel vertigo, or you're doing grocery shopping and you feel like the world is moving around you. So this can really affect a lot of these day-to-day aspects of your life. And with dizziness, this is when people often interpret like a sense of imbalance within their own space. So this is where you can, you feel a little bit dizzy. Like, for example, let's say you get up from sitting down for too long, you kind of feel that dizziness and you feel like you might be falling, but you can hold on to something. Or this could be when you haven't had food for a long time, and then you just feel a little bit dizzy, disoriented, maybe close to like a little bit of fainting. And some of the other common cause of dizziness is like low blood pressure. So these are with dizziness, you just feel like there's a sense of imbalance with their own space. It doesn't necessarily feel like everything's spinning. You just feel like something's happening and you feel a little bit lightheaded. So let's talk a little bit about the common causes of peripheral vertigo. So there are three common causes. And when you think about peripheral vertigo, you have to think about the ear and the inner ear specifically, because in the inner ear, there are, this is where balance is determined by the brain. So there is this there's these three little, they're called almost like little channels, and they have little stones. So these stones are what determines your balance. So sometimes what happens is, for some reasons, these stones can get dislodged. And when they're freely moving around, when they're not supposed to be, you start to feel a little bit of that vertigo, and you start to get that disorientation happening. So one of these conditions is called benign paroxysmal positional vertigo. So this vertigo happens when you, let's say, for example, suddenly change your direction. So you turn your head and you start to feel that that disorientation, the feeling that the world is spinning around you. So this is because those small crystals, those small stones are loose, and they just start to float when they're not supposed to. So with BPPV, what happens is it usually comes on when you just suddenly change, you turn your head, or suddenly get up from your bed. You just feel that vertigo coming on. So another common reason is an actual infection in the inner ear. So this is called vestibular neuronitis. So this can cause severe dizziness that can come on suddenly, right? So infections usually happen suddenly, and they can come on, and it can last to 2 to 3 weeks. So this could be potentially be a viral infection, could be a bacterial infection, but this is what causing is that there's a lot of inflammation. Okay, inflammation of the nerves in the inner ear, and it's causing dizziness and then that vertigo, because the ear just can't figure out where you are in terms of your positioning in the world. So this is another cause, and this is more of an infection related. The other one, and you might have heard of this, is called Meniere's disease. So this is quite a common condition, actually, that I see in men and women, and sometimes women tend to get this a little bit more. But this has multiple symptoms. So with Meniere's disease, you can get dizziness, you can get occasional hearing loss. Sometimes you even get ringing in your ear, and headaches and nausea too. And this is, we still don't really know the exact reason why people experience Meniere's disease, but stress has shown to be a big trigger for it. And also our diet has, been shown to be a big trigger for it too, especially if you eat a lot of salt, because the fluid in the inner ear and the way the inner ear balancing works is it's really dependent on your electrolytes. So your sodium, your potassium, and sometimes your magnesium too. So if these are ever off, imbalance, then you get these sometimes symptoms of Meniere's disease. And sometimes even drinking alcohol and caffeine can trigger this as well. So here are some of what you can do for Meniere's disease. So the more you tend to have it, the longer you experience it, you might have to go for a little bit more of the more and more in the surgery route. And this is something that me as a naturopathic doctor, highly suggest we try preventative treatments first before you go down this route. And some of the most common ones that we do try is, avoiding or eliminating most of the triggers that could be causing the ringing, the dizziness, and the vertigo and the headaches. So a lot of times that is like things like alcohol and caffeine. We try to remove that and see how you feel. Sometimes we definitely want you to be on more like an anti-inflammatory diet, because that can help with reducing inflammation that could be causing Meniere's disease. A lot of times you might be prescribed a diuretic. So diuretics are things that actually help with your blood pressure, but because they eliminate excess sodium for the most part, they can also help with eliminating some of that sodium that could be causing that ringing and the symptoms of Meniere's disease. So low sodium diet is very highly recommended. And also an anti-inflammatory diet is another one that we recommend as well. And avoiding some of the triggers. So this is where you want to come in and speak to either a naturopathic doctor or a nutritionist to see what are some of the changes that you could do if you're experiencing this on the daily. Like sometimes you might just be deficient in certain nutrients and certain minerals and things like that too. So tinnitus, raise your hand if you ever had ringing in your ears. And I've had this as well. My dad has had it for a long time, and tinnitus can be very, very annoying. It can just come on randomly, suddenly. You just hear this ringing in your ear, and you're just like wondering what's causing it, and it'll go away randomly as well, and then it'll come back again. And it just is very very disorienting and just annoying. And this can be a sign of something like Meniere's disease. So some symptoms is you just hear that constant ringing. It could be a buzzing sound. You could sound like there's a roaring sound, or like those like the sounds like waves. So it could be multiple of these sounds, but it's just like it's constant, and it'll come on randomly and then it'll go away randomly as well. So this can be caused by really two things. And what's really, really happening is that there's this little tiny hair cells in your inner ear, and it's the hair cells that tell the brain of the sounds that you hear. So these hair cells will bend or bend the other way, and that sends a signal to the brain to tell you what sound it is. So with subjective tinnitus, what sometimes happens is there's a little bit of disconnect with the brain and these little hair cells in the ear. So you have you think there's a sound, but there really isn't that sound. It's like the brain is creating it. Or where there's objective tinnitus, where there's actually like a muscle spasm in the ear that causes these hair cells to bend the wrong way, or keep going. So this is where a sound is actually created because of the muscle spasm in the inner ear. And this is where we have to think about our gut, because with any kind of inflammation, so this is vertigo, dizziness, Meniere's disease, and even like the infections I mentioned, there is definitely a sense of inflammation. And sometimes when we have a leaky gut, what happens is these toxins can leak much easier, way easier through into your body. And when a leaky gut is, basically, think about your gut lining is this one cell layer thick wall. Okay, so it's actually very prone to be damaged because only one cell layer thick. Our skin is actually 7 cell layers thick. So if you compare our skin to our gut lining, you're comparing cardboard to tissue paper. So you can imagine how very delicate the gut lining is. So what happens is, if we have a very inflammatory diet, so we eat a lot of processed foods, a lot of junk food, we drink a lot of alcohol, even sometimes drink a lot of coffee, and then we're exposed to, let's say, a lot of food poisoning episodes, and then have a lot of stress in our lives. These are some causes that can lead to leaky gut over time, because this is putting a lot of stress on the gut. So some symptoms are, you might feel super bloated, or you might have a lot of heartburn, or you're constipated, or you have diarrhea. So these are some signs of a potential leaky gut. And sometimes a lot of people even have a lot of skin conditions. So things like psoriasis, so flaring up of psoriasis, flaring up of acne, eczema can be caused because of a leaky gut too. So why this is important for vertigo and dizziness is because the gut is like the gateway for inflammation, okay? And it really protects us against all of these, different bugs that are in the gut, and it just really helps to have that wall, in between. And if there isn't that wall, or the wall is broken down, all of these things are kind of floating into our body, and sometimes it can cause a lot of inflammation in the ear or in these small spaces. And this is why it's important to make sure that your gut health is functioning well and it's not triggering the some of these conditions. So like, for example, Meniere's disease, like I mentioned, alcohol and caffeine and high salt can trigger it, and there could be a correlation with the leaky gut, which is making things a lot worse. So let's talk about, how do we make a diagnosis about peripheral vertigo? So this peripheral vertigo is basically if vertigo just starts without warning, and it stops just as quickly, and you just don't know what happened, like where it's come from. It just randomly starts and then stops just as quickly. And in your eyes, so one of the signs for vertigo versus dizziness is that your eyes can move without your control. So you might notice that, or someone close to you might notice that when you have an episode of vertigo, your eyes are like moving from one side to the other side very quickly, or it's like a very, very small, tiny, like little shaking. So this movement can go away if you focus on one point, like something that's like a little bit away from you, like one point, for example, a light or something, or a lamp. So this can go away, but it tends to only happen sometimes when in the first few days of the vertigo episode, and then it just goes to disappear. But usually when you think about vertigo, there is definitely some movement with the eyes as well that can help you differentiate between dizziness or vertigo. So here are some treatment options for peripheral vertigo. So we have to manage it by managing the condition that is causing the vertigo. So the vertigo is a symptom of an underlying condition. So with benign positional vertigo, so BPPV, which is the most common cause of vertigo, there is a 15-minute exercise called Epley Maneuver. So you might have heard about this. I'll go more into detail about how we do this later in the slides. This is a series of movements that you can do up to 3 to 4 times a day to help kind of resettle those stones that are free flowing back into its place. Then sometimes, anti-inflammatory drugs are prescribed as well to help with this inflammation. And this is where I say go to the anti-inflammatory diet more, or an anti-inflammatory herbs or antioxidants. You can supplement that to help kind of keep everything better and improved. And then for Meniere's disease, we always say to start with a low sodium diet, anti-inflammatory diet. You cutting down on salt, caffeine, and alcohol. And especially another big trigger for Meniere's disease is stress. So lowering your stress levels and finding the right techniques to do that can be really, really helpful as well. So let's try the Epley maneuver. So this is one of the most used, and it's very effective maneuver to help with your benign positional BPPV vertigo. So what happens, what you want to do is you have to, if you are experiencing vertigo quite a lot, it's okay to have someone there beside you to kind of guide you too. So what you want to do is, you are first you're sitting on the bed with your feet on the floor, and then you want to have a pillow, like in this animation. You want to have a pillow on the bed, and you're turning. Let's do the right side first. You're turning to the right side about 45 degrees to the right, and then you quickly lay down, and you want to have your head hanging off the pillow. So just like a little bit off the pillow, and then you're just like your ear is kind of onto the side, and then you quickly turn over about 30 degrees to your left, and then you quickly move your whole body 90 degrees, just like in that image right there. And then you wait there for a little bit, 30 seconds or so, and then you sit up slowly, and then bring your head to the center. So you can continue to do this for up to 3 to 4 times, daily, until you get that relief from the vertigo. So this movement, what it's really doing is it's kind of training your helping those crystals to travel back to where they're supposed to be. Because usually with vertigo, what's happening is those crystals, especially with the benign paroxysmal vertigo, those crystals are off, and this maneuver helps to reset them and put them back into where they are. So I highly recommend maybe taking a screenshot of this and trying this with by yourself. And sometimes you can even ask one of your loved ones to move your head for you, so that they know like exactly the right angles to do it, and and then do that as well. So here's the kicker. Peripheral vertigo can be chronic. So because the conditions that it's causing can be chronic. So because of this, what we really need to do is we want to be very, very integrative, like with what we're trying to help. So we want a combination of balanced exercises, lifestyle changes, and medications, possibly, and supplements to manage your vertigo. And sometimes you might even want to try vestibular rehabilitation therapy. So this is more of a specialized form of therapy you can done at a clinical setting, and sometimes even motion sickness medication. So things that can help with nausea, can ease that nausea that you might experience, especially with vertigo. So because it's chronic, that doesn't necessarily mean it is lifelong. So you can definitely find relief, and you can find improvements if you want to look at it in a more holistic aspect, and think about changing some of your lifestyle habits. So vestibular rehabilitation therapy, I believe Jessica, who spoke about her journey last week, found a lot of relief from this type of therapy. And this is a very specialized form of, therapy that's very targeted to alleviating these problems of vertigo. So, which is, disorientation, dizziness, and sometimes like with your eyes, to the movement of the eyes, and just kind of prevent any kind of falls and imbalance. Because usually, the really bad thing with vertigo or the dizziness is the fall itself, right? We hurt ourselves if we fall down and we hit our heads, or with our head, or any other parts of our bodies. So this therapy is really, I would say, individualized, and you have a trained clinician with you to help you with a lot of the symptoms of the dizziness, to help with that, and the vertigo as well. So this includes a lot of exercises, a lot of exercise to help stabilize your eyes, because if your eyes are moving up and down or to the sideways, then it's really hard to rebalance yourself, right? Because your vision is all topsy-turvy. So that there's exercise to help with that. And then there's also exercise to help with your balance. So training how to improve your balance and your steadiness, so that you can manage to do your daily activities, and you can do the work, and you're able to do work, you're able to have time for leisure and things like that. So this therapy is not super appropriate for the BPPV, what I just mentioned before. It's better if you do try the Epley Maneuver first and see if you find relief with that. This vestibular rehabilitation therapy is more for more central vertigo. So if it's something that's caused through an effect on the brain, and just to really help rewire those brain patterns, is what this therapy is mostly for. So this is the second type of vertigo. So speaking of that, this is the central vertigo. So this central vertigo happens usually because of another more deeper concern. Sometimes it's unknown, and this is usually because of an injury or disease to the brain. Because the brain is our taskmaster, right? It's a nervous system. It just controls everything, and so sometimes with head injuries or some kind of trauma, sometimes illness or infection, multiple sclerosis, migraines, brain tumors, and strokes. And these mini strokes called transient ischemic attacks. These are like tiny, tiny little strokes that you might not even notice you experience, because it's so minute. But your brain can get damaged from this. So then over time, this can show up as vertigo or dizziness, and and then central vertigo can be caused by that. So sometimes with central vertigo, it really is hard to find the actual pinpoint, the actual cause of it, and we have to kind of take this very broad look at it to see what are some of the causes. And it's mostly about managing the symptoms and of what's going on. So what are some other symptoms of central vertigo? So this can come without warning. So this is kind of why it's very, very stressful. It's like you could be doing something regular, you're going to grocery shopping, or you're going to pick up your kids, and it can come on without warning. And this can last for long periods of time. And these episodes are generally more intense. So you feel a lot more of that, you just feel like you're falling, or the world is turning upside down. Like, it's much more intense than peripheral. And you might need to actually sit down. You might need to sit down instead of standing. And It's like it might be a little bit hard to walk without getting help. And the eye movement, you can't really control the eye movement. So this is when the eye is like shaking. So it's going from usually it's going from side to side. And this can sometimes last for much longer than peripheral vertigo. And it doesn't, so the key is with this central vertigo, the eye movement doesn't, you almost can't control this. So you can't really point it at a distant object. So it doesn't go away when you're asked to focus on that object. And sometimes you can also get hearing problems. Hearing problems that you get from peripheral vertigo is not as common with central vertigo, because peripheral vertigo is mostly in the ear, right? So with central vertigo, you might not get some of those ringing, the tinnitus, but you get all the other symptoms from that. Headaches and weakness or trouble swallowing are also common with central vertigo. So why trouble swallowing? Well, that's because, there is the neuronal connection, right? So if there's something like a mini stroke or or trauma to the brain, so it will affect those nerve functions as well. So what are some treatments that you can do for central vertigo? So there is, the best thing we can do is find the root cause and go from there. So like, what is really causing the central vertigo? So you might actually be, a lot of tests might be done, things like MRIs, CT scans, just to figure out what's going on with the brain, and to see if there is some kind of underlying disease like multiple sclerosis or a tumor or a stroke that could be causing it. And so if it's a migraine, if it's a vertigo caused by a migraine, there is medications, and there's also, of course, a lot of natural therapies that can help with migraines. With ongoing conditions like multiple sclerosis, strokes, and some tumors, this is going to be like a whole holistic integrative effort to help you deal with those symptoms. And with usually with a stroke, you have to look at those other symptoms too. You got to make sure you see, do you have slurred speech? Do you have problems moving? Is there weakness in, like, especially one side of your face or your body, and there's numbness and tingling? And if you do experience these symptoms, you want to go to the emergency right away. And sometimes, trying chiropractic care can be really, really helpful for central vertigo as well. And I believe Jessica mentioned that a little bit in her talk, where doing chiropractic adjustments really helped resettle and like help with her central vertigo too. So there are a lot of options out there. So some natural alternatives for treating vertigo symptoms are, number one, I would say, is you must try an anti-inflammatory diet. So, a lot of fresh fruits, a lot of fresh vegetables, cutting down on your junk food, cutting down on your processed foods, adding in those healthy fats, healthy oils, adding in more of those healthier minerals. So like, instead of white table salt, you add in Himalayan pink salt or Celtic salt, and having that as a foundation. Then there is other options like ginkgo, for example. This is a herb, and it's been studied and found to be as effective as the leading prescription medications for treating vertigo. So ginkgo is very good. Managing stress is really important too. So, we have so many talks on stress management that we've done, myself and Dr. Justine, where, even something simple like going for a walk in nature can be really beneficial for reducing your stress. And, things like yoga and Tai Chi can be really good. And it's those movements, those gentle exercises can help you feel more stable, more grounded on the ground as well. And enough sleep, getting enough sleep is, key for so many things. So having that adequate amount of sleep, you need to make sure you're having from 7 to 9 hours, in between 7 to 9 hours of sleep, and good quality sleep. So restful sleep where you're sleeping for a long period of time. You're not waking up in the middle of the night. So that's really important too. And hydration. So like I mentioned with Meniere's disease, sometimes cutting down your salt can help improve symptoms. So when you have hydration, when you have that water, you're not as dehydrated. And it's easier for you to it's easier for your body to actually deal with any kind of salt excess, because it can be easily you can pee it out. But if you don't have enough water, then it's like harder for your body to eliminate it as well. So hydration is super important. And I know it's really hard these days because we're all wearing masks, so it's hard to even look at the water bottle, because we have to remove our mask and drink it. It's like a hassle, but you have to make it a priority. So that's how even I do it, is I make drinking water a big priority in my life. We have to these days, we have to adapt to our current situation. And then getting enough vitamin D is really important too, because it can help with inflammation. It can help regulate your immune system, and it will just help with a lot of the sometimes, like, it can help with the bone formation as well. And avoiding alcohol, so eliminating or trying to avoid a lot of the alcohol, a lot of the caffeine that could be triggering some of these vertigo symptoms is really important too. And try actually going decaf. Try decaf once a week, and then slowly kind of build yourself up to it. Sometimes you're only missing the taste, and it's just the taste and not necessarily the caffeine that you need. And with decaf, I've basically switched mostly to decaf now, and I don't really miss the taste of coffee, like the actual coffee, and it doesn't give me that crazy anxiety that I used to get before when I was drinking coffee. And of course, you can try essential oils. So these are things like peppermint and lemon balm oil. Do not take it, do not ingest it, but apply it apply it topically. So you can apply it close to your temples. And this can really help with stress relaxation and stress reduction. So peppermint is very cooling as well. So if you do feel that headache coming on, applying a little bit of peppermint oil onto your temples can be very beneficial for that. Ginger is a fantastic herb. It is anti-inflammatory, and it's also great if you are feeling nauseous. So ginger has been shown to help with a lot of that nausea. So you can have actually fresh ginger, or you can steep it in some tea. You can have some ginger tea. You can even take ginger in supplements, so supplement form. So if you just don't want to taste that, get that taste, you can take it in a pill form as well. And acupuncture can be really helpful for stress reduction, for pain with headaches, and also to help with a little bit of that vertigo symptoms, the other things like tinnitus, and helping with any kind of pain that you might experience too. So I do a lot of acupuncture at Justine Blainey Wellness Center, and it's something that I love doing because I see a lot of improvements in my patients. So this is something, if you're interested in trying, you can for sure book a meet and greet with me, or something that you feel like you want to even look into further. Feel free to chat with me if you are at the office. So these are some of the natural alternatives for helping treat the symptoms of vertigo. And we can't forget about, when it comes to vertigo, and really a lot of other things, we can't forget about the nervous system, especially when you have central vertigo and central dizziness. You have to see, like, is there some kind of something wrong with your spine, because the spine is where the nerves are coming through, and it is the main gateway for the nerves to come through. And if there's a little bit of a misalignment, right, it can be easily fixed, so that way you don't experience some of these symptoms. So for Jessica, doing adjustments really helped with her vertigo symptoms. And sometimes that's all you do really need, is to realign your nervous system. And this is such an important part of what we do at Justine Blainey Wellness Center. Is we look at everything. We look at the whole body to make sure that you are good to go. All right, so I hope that was very informative. I know I covered a lot of stuff there. So if you do have any questions, I'm sure you may have questions, feel free to send me a text, and I'll be happy to explain it in more detail with you. So here are some of our upcoming webinars. So we have our core strength to protect your back and waistline. Make sure you do take a look at that one. And then we also have, how does vitamin B12 help keep your brain healthy? B12 is an amazing B vitamin. And we also can talk about how can we be unintentionally feeding the number one real killer, which is heart disease. Then we talk about freedom through fitness talk, and flexibility and movement through interview with Jessica. So a lot of exciting, informative webinars are coming up, and we hope you take advantage of these. These are free, and it's amazing knowledge for you. And, we'd love to hear from you. If you can connect with us, you can do it through Facebook, Twitter, Instagram. You can give us a review on Google for the talks or your experience. And, we just love to hear from you. Even if you have any ideas for talks that you want us to talk about, those are all super welcome. So I hope you have a wonderful, wonderful evening. And thank you for, watching with us. Thank you for staying with us. And yeah, I will see you in another talk very soon.
I wanted to thank you, Dr. Udani, so much for walking through the kind of the medical side of vertigo and dizziness. And as a person who's actually had vertigo myself several times, it's pretty amazing to dig a little deeper into what's going on. Thank you so much.
You're very welcome, Angela.
Okay. Have a great evening, everyone.
Take care.